So a trigger point is very commonly referred to as a spot of hyperirritability in a muscle. So you'll oftentimes hear of trigger point therapy or myofascial release therapy to help relieve pain within the muscles. So who would be a candidate for this kind of work? Number one, a lot of trigger points or spots of hyperirritability, tightness, or even pain in a muscle can come from overuse. Now, that overuse might be related to a specific activity, like reaching for a computer mouse. It could be related to a specific postural holding pattern where you always have to sit turned in one direction. It could be due to a problem related to the neurology where the muscle is in a state of hyperfiring. But regardless of what that problem is, treatment to the myofascial system and the fascial system can be very effective tools for relieving pain and restoring normal function and efficiency into the body. The effectiveness of myofascial release has been shown in multiple forms of research and studies. And then in terms of myofascial release, the most effective forms seem to work not in one plane, but in multiple planes at varying degrees of depth based on where the restriction is. For example, if we were looking at a muscle along the center of my spine, is we could work superficially into the trapezius muscle or a little deeper into the erector spinae muscle or the whole way down deep into the spine into the little rotatories muscles. So myofascial release done with specificity is even more effective than just general forms of myofascial release. Myofascial release can also be aided by release tools such as the Vibroller Hex Pro that I have right here in my hand and therapy or massage guns, which put force into the body with velocity and then with vibration, which can in turn stimulate the nervous system and get it to actually relax via the proprioceptive system, which can also aid in the myofascial release that we might be working with.